what are the drug approaches to treat hypertension? Let's think about this logically. First of all, we're going to ask ourselves, what is hypertension? And the next question will be how to treat it pharmacologically. And then finally, the third question we'll ask will be, what drugs can we use for that? So let's start with the first question then. What is hypertension? Hypertension is what people most commonly call having a high blood pressure. Blood pressure is usually measured by two values. It's usually the diastolic and the systolic. The systolic is during a beat, systolic is during a beat, diastolic is between the beats. And so you usually get a number like, I don't know, 87 over 99. And this is in millimeters of mercury, although it should properly be given in pascals. So hypertension is when diastolic is greater than 140 millimeters of mercury. Sorry, that's not got it the wrong way around. I thought something was wrong. It's actually when it's systolic. So actually during the beat, which is the higher number, this is this one here. So that's what hypertension is. How can we treat it pharmacologically? Well, there are three ways of doing that. One is you can use beta blockers to reduce, so these are beta 1 blockers, to reduce cardiac output. So if you imagine a very simple model, an oversimple model, if you like, of the vascular system as being a heart as a pump, and I know it's a double system, but basically it's as it, you could almost model it as being a pump pushing a liquid around a system of tubes. So you can either, if the pressure here is too much, then you can do three things. You can either reduce the resistance here, you can try and get rid of some of the liquid, which also that will reduce the pressure, or you can turn this pump down so it's not pushing the liquid around enough. So beta blockers are turning the pump down. What about reducing the resistance? Well, here we can use calcium channel blockers, which help to cause vasodilation, and that is doing this. Of course, calcium channel blockers also do a little bit to turn the pump down as well. And then the third main thing that we can do, this isn't exhaustive by the way, but these are the main ones. The third thing we can do is to add diuretics. Diuretics make you lose water, they make you go to the loo. So the idea is to increase water loss. And so what they're doing is they're doing this bit here, getting you to lose water. So those are the main ways to treat it pharmacologically. And in terms of the drugs, other videos on this channel are available for that, but you usually have, of diuretics, the most famous ones are furosemide or thiazides, and drugs like spironolactone, and amiloride. So it's well worth remembering these. Those are the diuretics. So amongst the beta blockers, these are not used so much for various reasons in the primary treatment of hypertension, but can be used when the others don't work. Metoprolol and atenolol are the most well-used ones. And when it comes to calcium channel blockers, we're familiar perhaps with verapamil for heart rate, but the calcium channels in the vasculature are slightly different, so we tend to use more commonly amlodipine. So calcium blocker, the main one is amlodipine. That's a P, by the way. Amlodipine. So those are the main ones, and let's just complicate things ever so slightly because there's some other things you can do to bring about vasodilation. And these include angiotensin converting enzyme inhibitors and angiotensin, that's not right, is it? Angiotensin blockers, receptor blockers, ARBs. So really anything which decreases the peripheral resistance by causing vasodilation. So those are the main pharmacological treatments for hypertension and the rationale behind it.